Welcome to the Problem Gambling Prevention Providers monthly call. Today is November 14th, and so we're going to be moving through our agenda today. We are recording this meeting, and we'll be posting it on the Oregon PGS website, as well as we'll send the slide deck for those folks who don't have the time to sit through and listen to the entire recording, but they can still look at the slide deck and let us know if they have any questions. So our agenda for today is we'll do a quick roll call to see who we've got on the line, and then we'll work through the agenda to talk about our all provider training meetings. The online trainings that we spoke about last time, but I wanted to remind folks of those. A little brief update on Focus on the Future conference and the call for presenters for both that and the national conference, and then our new quarterly data collection tool, the calendars, and we'll talk a little bit about our positive cultural framework and community readiness, and then check in with you guys. So as far as roll call today, I have, these are the folks that I have showing on the line, and we'll check in, make sure I haven't missed anybody. So we have Benton County Health, so I'm assuming Kelly Losey's on the line with us. And I've got Deanne Mansfield from Union County. Emily Mossberg is back now again as the Problem Gambling Prevention Coordinator in Jackson County. Haley is joining us from Baker County. Julie Hines from Lane, Kim from Clackamas, Rebecca Knight is joining us from Yamhill, and Susan from Marion County. Did I miss anybody?
Columbia County is on the phone.
Okay, great. Thank you for joining us. So we have Columbia County on the phone. Anyone else who's just on the phone who's not online? Great. Well, thank you. So wanted to remind folks that today's meeting is happening because we had to make a slight shift to the schedule. I was accepted into a DHS OHA Leadership Academy that meets on the third Thursdays of the month, both all day Wednesday and Thursday, actually. So we shifted over for the next few months to accommodate that. So this is our schedule for our prevention calls for today, as well as January, February, and April. And then we'll go back to our normal schedule starting in May. So I thank you all for those who's accommodated my change in schedule, but we will revert back to our normal Thursday schedule starting in May. So then also a reminder that on the months that there's an all provider meeting, we had determined as a group of prevention providers to not have our Prevention Connect call that month so that folks could participate in the All Problem Gambling Services All Provider meeting. And so our next PGS All Provider meeting is scheduled for December 19th. And generally we have updates from the Oregon Lottery as well as from Herbert and Lewis with Tom Moore from Herbert and Lewis around data. And then both the treatment and prevention updates, try to make sure that that meeting covers both sides so that everyone can get caught up. And so the all provider meeting is next time is scheduled for December 19th from 9 to 10:30, and it is a webinar, so registration will be required, but more information will be coming out about that here real soon. Again, for those of you who are looking to see when the training or all provider prevention calls are happening, we update the 2017 training calendar, and we'll be adding things in for 2018 soon. Or if not, I think we may have already added some things for 2018. But you can always go to the training calendar on our Oregon PGS website to look at when the calls are scheduled and what the links are for registration. So that is another resource for you that you can utilize. So moving right along, we talked last time just briefly about the problem gambling online trainings that Lewis and Clark are hosting. They're web-based, and so there are 8 modules. and they'll be available up through December of 2018. You can register. These are free, but you can register online with Lewis and Clark, and went through, and of the modules that are there are some that are definitely specific to treatment side, but others are would make a good training for also for prevention. So we've highlighted those here in green, which ones would be appropriate. Not that you can't take all of them if you so chose and had the time, but those are the ones that are specific to problem gambling prevention. So wanted to make sure to have that out there for you guys and remind everybody again. And once again, we will be sending out both the slide deck as well as this recording so folks can utilize the slide deck to get the address for registration to be able to participate on those uh, trainings. Information has come out to you via email about call for presenters for the Focus on the Future conference that is happening in April of 2018. Conference occurs April 30th through May 3rd, so it'll actually move from April into May, but there is a call for presenters out right now. There's going to be the prevention track, and so we really encourage you all to, if you to take that opportunity to share and present at the conference so that we can all learn from the great work that everybody is doing. And so those submission proposals are open right now until December 8th. You can fill out the form online. If need be, though, we are also happy to send that application to you. And so we encourage you all to take that opportunity. You are the innovators in the field, and this is a great opportunity to be able to share that information. Those accepted to present will receive a free full conference registration, mileage and 2-night hotel stay to be a presenter. So again, please think about that and take that opportunity to share what you guys are doing in the field. Also, just a reminder that the National Problem Gambling Conference will be in Cleveland this year in July. And they also now, National Council also has out the call for presentations for that. And they are due by December 15th. And so if you would like to travel to Cleveland and share the work that you're doing in prevention, definitely submit a application to be a presenter. And we would look forward to seeing any of our Oregon people there this coming July. So with that, wanted to also, I want to back up just a minute to the Focus on the Future. One of the things that we're doing with the Focus on the Future for prevention is there's a pre-conference day, and we are proposing to have a 4-hour block that is for Oregon problem gambling prevention providers. So for those folks who do attend the conference, there would be that 4-hour block on the pre-conference day that would be specific to Oregon problem gambling prevention. And we will be working over the next month or two to determine what the agenda and what will be covered there. But it is an opportunity for the Oregon prevention providers to come together because it's been a while that since we've been able to come together as a group from Oregon. So that more information will be coming out about that soon. So wanted to just quickly remind folks again that we're no longer utilizing the Oregon Prevention Data System that for our data collection, and it was just the amount of data errors and cleanup that would need to be done, and the support that needed to be ongoing for OPDS made it not to be a great data collection system for us here. And so we moved away from that and took and transferred all of the biennial plans from OPDS into a logic model format. I think we're at about 99% of providers have approved how their plan was transferred into the logic model format, and are moving forward with utilizing their plans through that new template. With that, we then took the opportunity to think about what information were we wanting to gather for problem gambling prevention, and created the new quarterly data collection tool and released a template out. I believe it was early last week. No, actually, it was the week before. Went out on Thursday, the 9th, the new data collection template. So the goal is not to fill out the template and send it in as your data collection. It's just a template to be used if you need to have a copy of your data collection information that you'd be submitting on a quarterly basis, or to help you inform what you needed to gather. We are actually using a Survey Monkey tool for the data collection, and you should then be utilizing the link. The link is found actually on the Oregon PGS website under Prevention Data Tools, and there will be a quarterly link posted there so that you can go in and enter your data. Because of the late time frame in getting the new data collection system out, for Q1 data will be due December 15th, and then Q2 data will be due on January 15th. So you'll be utilizing the online survey to be able to do that. We'll be updating the Service Element 80 language to reflect the new changes to the biennial plan being in this new logic model template format, as well as shifting from monthly data collection to a quarterly data collection, because in OPDS your contract requirement was that you submit data monthly, and we are shifting to quarterly, and we'll review that at the end of the biennium to determine if we can make any changes to that or if quarterly works for us. So if you have any questions in regards to how to utilize the data collection tool, and or if you need assistance pulling any of your data from OPDS that you would like to have pulled, I am happy to do that. We still have access to OPDS until the end of December. And so if we need to go in and pull any data for you, please let us know prior to the end of December so that we can get that information pulled out for you. So before I move on, are there any questions about the new data collection system? Okay, not hearing any, I would say at this time, if you haven't had an opportunity to take a look at it yet, you can do that. We did make a change. I do apologize for the numerous emails that have come out in the last week or so. Initially, we were hoping to use just one link so we wouldn't have to replace the link on the web page all the time each quarter for the data collection system. But using that format would not allow people to save their information and go back and make changes during the quarter if they needed to. And so with that change, we've now made it to where there'll be a new link each quarter to submit your data for. So you'll have to each quarter go to the website to get the new link, and we'll send it out as well. But we did make that change after we got some feedback that if folks got interrupted while entering their data, would not allow them to go back and make changes, or if they had forgot to enter something or realized that they had done a data error in their entry, that they weren't able to make those changes. So we made a shift to there'll be a new link each quarter. So not seeing any questions, I'll move forward. Wanted to make sure that everyone is aware that the 2018 problem gambling awareness calendars have been mailed out. Everybody should have received those. If you haven't gotten your shipment yet, let me know. It means they're lost in transit somewhere and we potentially had a wrong address for you. But we want to make sure that everybody's gotten them. We actually still have 68 boxes here on site. So if you are in need of more calendars, please let us know. We're happy to send them out to you as soon as possible because we definitely would like to make sure they're getting out in the community. I have a small typo here. It actually should be the 2019 Problem Gambling Awareness Calendars. We'll make that change. the artwork must be hand drawn, no clip art or computer generated submissions was something that we took a look at after this last year and wanted to make sure that we were keeping the field level for our youth submitting their artwork. And so for the 2019 calendar contest, the artwork needs to be hand drawn, not computer generated, so not utilizing any clip art. The criteria and information in regards to when all of the artwork is due back here from your local contest went out in a letter, as well as we sent out a handful of flyers. I do have a few flyers here left that we'll be sending out to everyone as well of the colored copies, but we did send out a editable form which will allow you to put in your information for folks to return the flyer to you, or not, I'm sorry, not the flyer, but to return the artwork to you for your local contest. And then once you've had your local contest, then you can submit 5 entries to the state for then the statewide contest. So we've had great feedback from folks in regards to the calendars that went out. So hopefully you guys were all pleased with them. I know that here we were very happy with how they turned out this year. And so we can only strive to continue to do better and keep blowing our own socks off on this one. So anyway, the contest information should all be out, the criteria and the due dates. And so if anybody needs that information, I'll be happy to send it out again. Quick update just on the Positive Cultural Framework project. Currently, there's a random selection of prevention coordinators that they kind of put everybody into a pool and randomly selected, trying to make sure that we were covering the state well, but taking a qualitative interview to gain a better understanding of the prevention coordinator's knowledge, as well as attitudes and beliefs relating to problem gambling. And then also around intervening and knowledges of resources. And so there are a handful of you that were selected to participate, and hopefully have been able to connect with Kelly Green and get that scheduled. If we end up with some scheduling issues, they will go back and select a few more providers to ensure that they get a good pool. From that, then all of the work that they're doing at this point is going to help design the messaging for our campaign. And so any input that you guys provide is very useful for us. And so we're excited about that. And so the next meeting will be on December 6th from 11 to noon with our next provider webinar. And they'll be walking through with us the 7 steps of communication and relationship to our project. And so a link will be coming out about that real soon. So I wanted to quickly get to the community readiness survey funding opportunity that we sent out to you folks. Problem Gambling Services released that opportunity for our prevention providers to apply for some additional funding to implement the Colorado State University Community Readiness Tool. So we're specifically using that tool. Letters of intent, including a proposed budget, are due to us by January 15th of 2018. So it's not a grant proposal that you need to write, but you do need to have a letter of intent signed by the appropriate people in your organization to ensure that that they have agreed to allow this project to move forward. And then your budget. We are doing a webinar on the community readiness assessment. It's a pre-webinar to help folks determine if they want to apply. It'll be happening on December 7th with registration required. It'll be happening from 10 to 11:30. I believe I sent out the link for that yesterday to folks. But just a reminder that it's the information that will be shared there will be more on how to what to expect from the project, and our technical assistance advisor, et cetera, will be with us for that to help you determine if you want to participate. But budget, we're looking at that folks can include things as far as incentives for people to participate. The budget would be including folks attending the trainings. the best practice is that you do a minimum of 8 interviews, and information is that doing additional interviews does not generally change your result, but it may help your community feel that better if they have a larger pool of folks interviewed. So again, 8 interviews are required, but if your county chose to do additional ones, then you would be budgeting for additional interviews. We understand that you as coordinators have very limited time, and so if it was necessary, you could also utilize the funds to subcontract out. You would need to have an interviewer and 2 scorers, and so there's a variety of ways you can use the funds to get the project done, and so we would just be looking at a budget to see how you were proposing to do that. There is a up to $15,000 per provider to apply for. This is not a competitive process. It really is meant to help your community determine your community readiness to address problem gambling and use that information to build your plans. So again, the community readiness survey really looks at the attitudes, the efforts and activities that are going on, the knowledge and the resource, as well as you would be interviewing community members and leadership so that you can gather great information about what's going on in your community. The 5 domains that the readiness survey is assessing is, again, the community's knowledge of the issue in general, so the issue being problem gambling, their knowledge of the efforts that are going on in their community around problem gambling, whether it be prevention or treatment. What's the climate in regards to addressing problem gambling? Where is your leadership and awareness of resources? So many of our providers across the state, when developing their plans, have stated that they want to work on problem gambling awareness, but when it comes to measuring it, they're not aware of what's their baseline awareness level. And so this new the readiness assessment will give you what level your organization, or I'm sorry, not your organization, but your community is in regards to these 5 key domains, and it will then give you a measurement point that you can utilize moving forward into your this sounds very weird to say, but 2019 to 21 biennial plan. So though we are having that webinar on the 7th, are there any questions at this point moving forward about the new funding opportunity that's available?
Hi, Roxann. I have a question. This is Kim.
Hi, Kim.
Hi. So for the community, are you talking about like the whole county or like doing like a specific city to kind of be more strategic? I was just kind of curious about that
Right.
for
So
the readiness.
when you're looking at it, you certainly could narrow your focus to a specific part of your community. As you look at the readiness assessment book that we sent out, it will be edited to reflect problem gambling language, but we did want to get it out there to you, is that you really would be
Okay.
looking at your community and defining your community how you see fit. And though you could subcontract out these funds, it will be very important as the problem gambling prevention coordinator that you're still involved in the project and helping determine who you would be interviewing in the community.
Okay.
And so, yeah, it can be, you can certainly narrow your focus, or you could choose to do some counties may choose to say we're going to do a total of 16 interviews because we want to hit 2 different communities within our county, to kind of get a cross reference of communities, because they can vary. Each county can have both very very populated areas of their community and then be very rural in other areas. So certainly you would want to think about how to best address your county in that. But again, we also will be having technical assistance. Um, we'll have a training on how to utilize the tool, but there'll also be ongoing technical assistance for providers, whether it be helping them identify who their key stakeholders should be that they would be interviewing, et cetera. So we're really trying to wrap some good support around this to ensure that the implementation teams for the readiness assessment have all of the support that they need. Other
Okay,
questions?
thank you.
You're welcome. Other questions? For some of you who were engaged in this, your counties had SPIF dollars to implement the SPIF project. You utilized the tri-ethnic community readiness assessment, which is what this is. It's been renamed as they've moved forward, but so you may have already had experience with implementing the assessment, and know that there are a variety of things that you could utilize funds for, also transcription services, etc. uh, um, could be purchased because you want to be able to transcribe the interviews as they were word for word verbatim, and so being able to do higher transcription services, purchasing recorders for interviews, etc. So those are all things that you can be putting in your thought process when you're thinking about developing your budget if you're going to apply. So any other questions? Okay, great. So we're now at that place, I believe, in the agenda where it's your opportunity to share with each other things that are going on in your community, or ask questions if there are things that you need additional support with. So I do this as a roll call so that we can make sure everybody gets the opportunity if they so choose. You can also choose to pass if you have nothing to add. So it does appear that Kimberly Jones from Jefferson County is on the line. Kimberly, are you there, and do you have any updates or questions for the group?
We're doing pretty good. We're finally at full staff. One thing that we have done a little bit differently is we have actually hired a youth on a part-time basis, and we're looking forward to incorporating problem gambling prevention into her job description. Because youth are more likely to hear the message from another older youth than they are someone like me who's as old as dirt. But we're moving forward and we're doing well.
Great. Thanks, Kim.
Uh-huh.
So Deanne Mansfield, Union.
Oh, sorry, I had trouble getting it unmuted there. I think I'm just trying to get my report done right now, and then getting ready to gear up for the art search, and thinking about, trying to be forward thinking and thinking about the Problem Gambling Awareness Month of March and what I want to do for that campaign, and try and, kind of liven it up a little, do something new, and I think that's about it.
Okay, great. Thanks, Deanne. How about Emily in Jackson County?
Hey, I don't have too much update on, just taking over again. I was kind of out of the loop for a little bit, but I'm just excited for the grant opportunity, especially right now, and we'll start working on that, as well as prepping for the calendar art contest, and also what I can't remember who just talked, but what she was saying about the Gambling Awareness Month.
Okay, wonderful. How about you, Haley in Baker?
Hi, Roxanne. I don't have much to report. I'm just kind of brainstorming ways that I can promote the art search. Hasn't been done in our community for a while, so like Dan said, I'd like to come up with some new and creative ways to promote that.
Okay, great. And if there's ways, I mean, I'll put this in my thinking cap as well to think if there's ways that we can help support you guys. I know that at the national level, when they start looking at Problem Gambling Awareness Month, there's planning around that as well. And as soon as tools become available to us, we can access those and get those out to you. I know last year we posted on Oregon PGS on the website. Should be under the Problem Gambling Awareness Month. There was a guidebook that came out from, I want to say, New York, that also had some helpful tips on how to look at Problem Gambling Awareness Month. A little separate from our art contest, but things that could be done during Problem Gambling Awareness Month. So I'll go back to the website and see if we can send that out to folks as well, as it was part of a toolkit that New York created. And so, but as we have information available, we'll get it out to you guys. So thanks. So Jesse Walawa, are you there?
Hi. Yep, I'm here. I don't really have anything new to add, just kind of the same as everybody else. I was able to partner with the gambling treatment person in our county and use some of the OHA grant funds to help her purchase some workbooks for problem gamblers. So that's kind of cool. But other than that, just the same as everyone else.
Okay, great. Thanks. How about you, Kim?
Hi. So I went to the Health Promotion Chronic Disease Prevention Conference last week. I was invited through my coalition, so I really felt like it was a good opportunity to me to have a gambling voice, because gambling was not really discussed at all at that conference. And it's not official yet, but I was asked through my coalition if I wanted to chair our coalition meeting. So we're going to be voting for it officially tomorrow, or I mean on Wednesday at our meeting. So that's something exciting that they had asked me if I wanted to do that. And as well, I've been having a hard time with getting people to do the art contest. So I'm making a list of people involved with the schools, and I'm going to be sending out letters and include the calendar so they can see what it's like, and then follow up with an email to see if I can get some middle schools involved with that this year.
Great. Well, congratulations on being asked to chair your coalition. Great way to ensure that you can keep problem gambling integrated into the work that they're doing, and great opportunity as well to also share the voice of problem gambling at the HICCADIPS meeting. It was definitely their grantors meeting for their alcohol. ADPEP, so Alcohol and Drug Education Program, which is formerly known as the Substance Abuse Prevention Program here, and tobacco prevention. So clearly, I mean, their focus was definitely around ADPEP and tobacco TPEP. So not a bad thing that problem gambling wasn't on their agenda, because definitely that was their conference for supporting their contractors that are responsible for substance abuse and tobacco prevention work. So, but we're always happy to be at the table whenever possible. So great.
Definitely.
Great. So hi, Katie it looks like Katie Plum has joined us from Crook County. And Katie, we're at that point where I'm not sure if you have been on the line for a while or you just popped in, but just as provider sharing time. So is there anything that you would like to share from Crook County?
Good morning. No, I did just hop on. I don't think I have anything huge to share. We did get our calendars, and we're working on some partnerships with some of our high school students to promote the art contest in the middle school. So kind of using some peer mentoring opportunities to plug that program and that opportunity at the middle school to see if we can get some traction that way. So that's exciting. And yeah, I think that's the biggest thing that's happened most recently.
Great. Well, and I let folks know that we're we're recording this meeting, as well as we'll be sending out the slide deck so that you can take a look at the slides and not have to listen to the recording. So if there's anything that we covered that you have any questions about, please feel free to give me a call and I'll be happy to catch you up. So
Great, thank you.
yeah, so great. So Rebecca, Yamhill County.
Oh, I don't have that much to update on since our last call. Last month in October, I did present on our Elders Activity Center for the Confederated Tribes of Grand Ronde. And that was quite interesting because they kind of tattletale on each other and tell me who has gambling problems, why I present, and I didn't know exactly what to do besides like give them the number and talk to them, but not like make it all about the people who do have problems. And then I have been passing out the calendars to our treatments, and then I last week presented in one of the 8th grade health classes and talked about problem gambling, and then also promoted the art project, and the teacher's really on board. And this Friday I do their 7th grade class, and then I hope I can get into their art classes and then move to the other schools. That's pretty much what I've been able to do this month. That's all I really have.
Great. Well, thank you for sharing. Sounds like you've been busy no matter what. So yeah, and again here it's, you know, a lot of times it's also whether you know, it's not about what you have actually, it's just an opportunity to share. So we don't want people to feel like they have to share, or that it appears that we're tracking the activities that way. So just a good opportunity for folks to listen to each other and pick up on ideas of different things to do. So Susan with Marion County.
And then there was me.
And then there was you.
Good morning, Roxann.
Good morning.
So I have a few things that we are working on, sort of a revamp and a rethink of our youth presentation. And so my partner and I here at Marion County will be updating and a little bit of recreating a presentation for middle school target. Our first classes that we've been asked to teach in school now are like mid-December, so we're getting to the point where we need to get that done, and so I may send that out to a couple of you to review and for some feedback. Trying to get our reports done and then work on art search. And I actually had a couple of thoughts about the art search, because as I'm listening to people report in, they're saying having a hard time doing it or starting to think about marketing the art search. And I'm just wondering how difficult it would be, Roxann, on our problem gambling provider website, to under that media tab, to put a art search marketing ideas or something like that, where if I develop a social media blurb that has a little picture, I could post it there, other people could swipe it real quick. Or if I write a letter to a school teacher, I could post a copy there and other people could just change the names, dates. I don't know if that's helpful for us to kind of work together on that, but it is a challenge to try to get new kids to participate. And I would certainly welcome new social media posts from others that I could just pick up and use. Does that make sense?
Certainly, and we're more than happy to post those on Oregon PGS and let folks know where they're there. As people have materials that they can forward to us, we're happy to make sure that's the purpose of the website, is to be a resource to you guys and for folks to share ideas and tools.
Maybe other people could kind of chime in if that would be useful to collaborate on the marketing, or what they think about that.
Yeah, so for the folks on the line, let's see, is there, I guess,
of course we're all muted, right?
Yeah, everybody's muted. But is there anybody who's against the idea? That might be a little bit easier. Is there anyone who feels that using Oregon PGS to share that information, they wouldn't be interested in doing that? Yeah, I'm not
we're getting a lot of comments there.
Yeah, and so I'm thinking that probably that folks would be in favor of it. I'm seeing, sounds great. Social media collaboration would be really helpful. So
yeah, maybe would just be kind of a good little pilot to see. I think one of my challenges to doing social media is always, oh, I got to create something, or oh, I've got to go find something. And maybe this is a good way to see if sort of a group area to put things in that could be taken back out could work on a larger scale for our overall social media. So we're all kind of saying the same thing, or, if one person finds something great, then we can all have access to it without having to have 26 of us, 30 of us, looking.
Right.
That makes sense.
Yes, yeah, definitely.
What have other people found?
Definitely makes sense. So, and we're definitely happy here to be the conduit for getting that out to you guys. So, and again, I'm going to put my thinking cap on and see if there's other things that we can produce. I mean, there is that whole piece around how to do things around Problem Gambling Awareness Month, as well as how do we take and look at the art search and really refresh it, I guess. Because I know that we did bring up whether or not it had kind of was reaching the end of its desired effect, and that if people were ready to do something new. And I got quite a bit of feedback about, no, do not get rid of the art search. And so certainly we want to make sure we keep that going, and that the calendar is something that can be utilized by everyone across the state if they so choose to participate. I mean, we do have some counties that do their own type of calendar search and stuff, and so they don't participate in the statewide contest, which is definitely their right to choose to do. So but we certainly want to make sure that if there's new ways to market it, whether it be on social media or how to gain interest at the local level with your schools, or potentially looking at some youth groups of different types, because there's a lot of different youth groups out there that it might be a great activity along with it, the educational component. Even through, like 4-H, et cetera, or different groups of youth that are coming together. So different ways, sometimes the schools are becoming more difficult to get different projects into because of their timelines and needs that they have as well. So I think it's definitely something we can take a look at, and some great opportunity for some brainstorming. So thanks, Susan.
Sure.
Did I miss anybody? Oh, Claire from Columbia County.
Yes, Heather and I are here from Columbia County, and Heather's done a great job bridging some partnerships with our school counselors to get into those school settings. So she's working really collaboratively with them to find out who the best teachers are to partner with. We also just came back from the HIPCADIP grantees and contractors meeting last week, and I did email you, Roxann, but just wanted to do another little reminder, another little plug for the idea of having some problem gambling prevention questions that would be optional to include in our retail scan. As a HIPCADIP contractor, we'll be required to do a retail scan around the tobacco and alcohol marketing and promotion at about 20 of our local retailers, and it would just be a great opportunity for very little extra time investment to also be able to do a scan for some lottery or other gambling kinds of promotional materials that we see in stores. So we'd love to have some state guidance on how we could really easily put some problem gambling questions on that survey.
Right, and I did get your email and responded back, and I will be following up with public health, one to see what the format of their scan is looking like. We have in the past, problem gambling prevention providers across the state have done environmental scans at retailers, and we actually have kind of not marketed, but designed it around different retail scans around alcohol and tobacco. And so definitely see it as an opportunity. I have a phone call with public health today that I will follow up with them as well, because it would be great to see the design of their scan and what they're going to be requiring, to see where and how, if they're going to merge the two scan, if we were tried to tag on and merge a scan, that the that the design is collaborative. So definitely want to take a look at that. We definitely have had other environmental scans done and had talked about actually trying to develop a statewide problem gambling scan, to look at that and to help with. I think that the request was really to take a look at how do we take the data that we're learning from those scans and utilize them. And we had to kind of put that on the back burner for a while, but I think it's something we can move up as well. So it may not be a collaborative part, but it certainly is a piece where we can go back and look at our environmental scan again, because we have all of the information that we had from our group meeting around that a couple of years ago. So, but I thank you, Claire, for bringing that up, and it certainly might be a great opportunity. Anything else from you in Columbia County or anyone else?
This is Deanne. I did remember something that I was going to check in with you about.
Okay.
I have a billboard that I need to swap images on. And last time I worked with the lottery, are they still available to help us like they were?
Yes.
It's been a while, so I wasn't sure. And then
go ahead.
Oh, I was just going to ask if our contact is the same.
So yeah, so Thais at the lottery has helped with the billboards and is still willing to do that. And there may be one that they did for another community that could just be refreshed for your community as well. So certainly, yeah, I think that's Thais is still a great resource for us. We're hopeful to start building a library of all of those, so that then people can just go to our library and select things that have been created and maybe personalized for your own community. But yeah, so same contact. So anything I can do to help to assist with that is great too. Thais will usually always include me on that. So I get to see copies of all the different things that people are working on. So thanks, Deanne, for bringing that up. So yeah, good
Sure.
question.
Thank you.
Anything else? Great. Okay, not hearing anything. So our next Prevention Connect call is January 23rd. So if there's anything that you would like to have put on the agenda, please, please, please send that to me. Definitely want to make sure that this call meets you guys' needs. And so if there's agenda items that you would like to make sure we're covering, that we get that on there. There will be the all provider call on December 19th, so that we don't want anybody missing their problem gambling update, so you'll be able to capture that in December. So with that, if there's not anything else from the rest of the group, we're going to finish up just a couple minutes early here and let you loose on your communities to do the good work that you do. Just a quick plug that we do have calendars, so if you'd like additional calendars sent to you, they come 62 a box, and we're happy to ship you out as many boxes as you feel that you can utilize in your community. It's first come, first served till they're all gone. So with that, I hope you all stay dry and have a good rest of your November, and look forward to seeing or hearing some of you on the line come December. Take care, and we'll talk soon.
Thank you, Roxann.
Thank you.
Thank you.